This care plan will address deficient knowledge with rheumatoid arthritis. Check the description below for your free care plan worksheet. This will be useful for writing down rationales provided in this video. Before we start, let's have a general understanding of rheumatoid arthritis. An inflammatory, persistent, and systemic condition is rheumatoid arthritis. Autoantibodies and immunoglobulins interact to cause rheumatoid arthritis, which is categorized as an autoimmune illness. The main autoantibody that reacts with immunoglobulin G is rheumatoid factor. The illness typically manifests as symmetrical synovitis, mostly in the body's tiny joints. Exams love to ask this, especially when you need to know the difference between rheumatoid arthritis and osteoarthritis. Periods of remission and extended exacerbations of the disease, during which the joints may sustain damage, are characteristics of rheumatoid arthritis. In the initial phase, the synovial membrane becomes inflamed and thickens, associated with an increased production of synovial fluid. As this tissue develops, it causes erosion and destruction of the joint capsule and subchondral bone. What are the related factors of rheumatoid arthritis? The common risk factors are the following: insufficient information, insufficient interest in learning, insufficient knowledge of resources. What are our goals as a nurse for the patient? Here is the common expected outcome. Patient verbalizes understanding of rheumatoid arthritis and treatment. Simple, right? So now, how can we achieve this? As a nurse, we will need to assess the following. Determine how well informed the patient is about rheumatoid arthritis and its management. This information provides the starting base for educational sessions. Patients will be responsible for evaluating their rheumatoid arthritis on a daily basis to make determinations about exercise, the use of analgesics, and seeking medical intervention. Determine the patient's self-efficacy to learn and apply new knowledge. Increasing the patient's confidence in their capacity to gain the necessary knowledge or abilities may be the initial step in the teaching process. For the patient, several lifestyle adjustments related to the management of rheumatoid arthritis can be challenging. Identify any existing misconceptions regarding material to be taught. Many patients might believe that rheumatoid arthritis is an inevitable aspect of aging. Some people might believe it to be the same as osteoarthritis. Now let's go over important nursing actions to provide for the patient. Introduce or reinforce disease process information, unknown cause, chronicity of rheumatoid arthritis, process of inflammation, joint and other organ involvement, remissions and exacerbations, and control versus cure. Patients must have accurate and comprehensive information as a foundation for their active participation in disease management. It's important to teach the patient initial presentation with symptoms of joint inflammation such as the following. Patients may experience systemic symptoms such as fever, chills, loss of appetite, low energy, and weight loss. The synovial lining of the joints and tendons becomes inflamed, with a progressive proliferation of the synovium within and outside the joint capsule itself, pannus formation. Joint inflammation may affect more than one joint at a time, and usually the inflammation affects the same joint bilaterally. Why should the patient understand symptoms? Well, because simultaneous, symmetrical joint inflammation differentiates RA from other forms of arthritis. This inflammatory process is not limited to the joints. Progressive changes occur in the heart, with pericarditis, congestive heart failure, and cardiomyopathies developing. In the skin, in the kidneys, with chronic renal failure developing, and in the lungs, with chronic restrictive pulmonary disease and repeated infections occurring. The next thing we want to teach the patient are tests that diagnose rheumatoid arthritis. The following tests include rheumatoid factor, or the RA antibody. Not all rheumatoid arthritis sufferers will have a positive antibody titer, which must be noted. Hemoglobin and hematocrit. Patients with rheumatoid arthritis may develop normocytic, hypochromic anemia. Iron deficiency anemia may be present. Serum complement. This laboratory value is decreased during periods of exacerbation. Erythrocyte sedimentation rate. C-reactive protein. Laboratory tests may include acute phase reactors. These two tests are good indicators of the inflammatory activity of the disease. Joint arthroscopy. Arthroscopic examinations are used to evaluate for characteristic changes in synovial fluid. Cartilage destruction and pannus formation may be identified. Now, what can we teach the patient about treatment and management? Here are the following guidelines to encourage the patient to do. Adequate sleep, at least 8 to 10 hours each night with periods of rest during the day. Sleep improves immune system performance, which lowers inflammation. Increased joint pain is a result of fatigue. Rest of the affected joints with splinting. Splinting is sometimes helpful in protecting joints, which can become overused during the course of daily activities. Application of hot or cold packs on painful, inflamed joints. Alternating the use of hot and cold is sometimes helpful in reducing the local inflammatory process in the joints. Individual patients may prefer heat over cold or vice versa. Relearning how to perform activities of daily living. As joint deformity progresses and joint mobility decreases, the patient may benefit from using assistive devices to complete ADLs, such as using long-handled eating utensils. As a nurse, you will want to be aware of medications used for patients with rheumatoid arthritis. Patients usually benefit from a combination drug plan that includes a non-steroidal anti-inflammatory drug, NSAID, and a disease-modifying anti-rheumatic drug, DMARD, or a biological response modifier. Short-term therapy with corticosteroids may be included during exacerbations. Let's go over these two types of medications. Disease-modifying anti-rheumatic drugs include hydroxychloroquine, methotrexate, gold salts, sulfasalazine, azathioprine, leflunomide, and cyclosporin. This group of drugs are recommended as the first line of treatment for a patient diagnosed with rheumatoid arthritis. Because of its efficacy and toxicity profile, methotrexate is the recommended initial treatment in all patients who have not previously received disease-modifying anti-rheumatic drugs. These drugs substantially reduce the inflammation of rheumatoid arthritis. Studies suggest that disease-modifying anti-rheumatic drugs can reduce or prevent joint damage, preserve structure and function, and enable a person to continue his or her daily activities. Several weeks to months of treatment are often necessary before the effects of disease-modifying anti-rheumatic drugs become evident. NSAIDs. These drugs relieve mild to moderate pain and have an anti-inflammatory effect. The anti-inflammatory effect is not strong enough to alter the long-term damaging effects of rheumatoid arthritis on the joints. The selective NSAIDs act by reducing prostaglandin synthesis via inhibition of cyclooxygenase 2. As a result, this class of NSAIDs has fewer gastrointestinal side effects than non-selective NSAIDs. These drugs may be used in combination with DMARDs. Corticosteroids. Steroids have strong anti-inflammatory effects. However, if used alone, steroids have only a modest effect on decreasing arthritis damage. Important teachings with medications. A patient taking these medications need to know the importance of long-term follow-up. Patients with rheumatoid arthritis should be monitored for an indefinite period. Patients in complete remission should be seen every 6 months or yearly. Patients with recent disease onset, frequent exacerbations, or persistent activity should be seen more often depending on the treatment used and disease activity until control is achieved. Aging may alter hepatic function, thus decreasing the metabolism of drugs that are broken down in the liver. The possibility of adverse effects and drug interactions should be monitored in older patients. Well, that's it for this video. Check the description below for your free care plan worksheet. This will help you retain information for passing exams. Good luck with your studies. Support this channel and please like, comment and subscribe.